Hello, hello, NCLEX Crusaders. How are you? Let me know if you can hear me. Let me know if you can hear this live presentation. Welcome, everyone. Welcome to NCLEX Crusade International, our English side of NCLEX Crusade. I want to welcome you for joining this YouTube live. We're going to continue with the EKG series. This is day number 6. So if you're interested in learning how to answer EKG questions and you have missed the previous days, I encourage each and one of you to go back and watch the previous days so you don't miss any of the good information that I provided during that the past few lives. And let's begin today's teaching. We're going to talk about some interesting topics today. Let me get this here. There you go. Okay, perfect here. All right, so very good. Welcome, everyone. See, if you're new here, let me know where you're joining from. You're here in the US or if you're somewhere else. Welcome to NCLEX Crusade. And let me know where you are in your NCLEX preparation. So have you taken the NCLEX before? Are you planning to take the NCLEX soon? Let me know so I can see who's joining today. For the past few weeks, I have been teaching about EKG interpretation. I've talked about the rule of 5, how to use a step-by-step approach on analyzing an EKG. Basically, I taught about these 5 steps of EKG interpretation that is an amazing tool to analyze NCLEX questions where they are presenting to you an EKG strip. I talked about identifying if the rhythm was regular or irregular, identifying the heart rate, also identifying the PR interval, the QRS interval, the QT interval, but I also talked about identifying the relationship between the P's and the QRS. So if everything that I'm mentioning to you sounds like you're not too familiar with those concepts, go back to our previous training, previous days, so you can identify, okay, and learn these steps of the EKG strategy. So I see somebody from Egypt, wow, Qatar, excellent. All right, Kenya, very good. Oh, welcome everyone. Dubai, very good. Okay, so the first thing that I want to talk about is heart blocks. I mentioned on the previous live a little bit about how to interpret the heart blocks, whether it is a first degree heart block, second degree type 1 heart block, second degree type 2 heart block, and third degree heart block. I gave you some examples. We did like a little quiz so you can practice EKG interpretation. But today, I want to share a tool that I used many years ago. When I first learned about heart blocks, it was an amazing tool that helped me a lot. That is, I would say, it's funny. It's a little funny. Is interpreting EKG heart blocks with a poem. And you go, really, professor, a poem? Yes, it helps you remember some characteristics of EKG interpretation. The poem goes like this. Okay, so just listen to it, write it down, because it's going to help you remember. And I'll explain a little bit what the poem is saying with understanding. But the poem goes like this. If the R is far from the P, then you have a first degree. Longer, longer, longer drop, then you have a winky buck. If some P's don't get through, then you have a Mobitz 2. If P's and Q's do not agree, then you have a third degree. So that is the poem. It's a very interesting tool to use to remember heart blocks. But let me explain it little bit by little bit. Okay, so you can understand how to use this poem. The beginning of the poem says, if the R is far from the P, then you have a first degree. So what do you have on a first degree heart block? The only thing you can see in a first degree heart block is prolongation of the PR interval. In other words, the distance from the P to the QRS complex is longer. It's constant, but it is longer, higher than 0.20. That's what that part of the poem represents. If the R is far from the P, meaning prolongation of the PR interval, then you have a first degree. The second half of the poem says, longer, 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 drop, then you have a winky buck. What that's representing is a second degree type 1 heart block. Second degree type 1 heart block. What do you see in a second degree type 1 heart block? You see that the PR interval, the distance between the P and the QRS complex, it is longer, then longer, then longer, until you have a missing QRS. That is what longer, longer, longer drop means. When that happens, you have a winky buck, which is a second degree type 1 heart block. The third part of this poem says, if some P's don't get through, then you have a Mobitz 2, or in other words, a second degree type 2 heart block. So what is this saying? In a second degree type 2 heart block, what happens is that you have some P waves that are not followed by a QRS complex. And basically that happens because without any warning, there is absence of QRS complexes. It is different than winky buck. Winky buck is kind of like telling you, advising you, listen, the PR interval is longer, is longer, is longer. Here is coming the drop, the QRS drop. In Mobitz 2, in second degree type 2, basically it's not like that. So you're going to have some P's and QRS, but you're going to have some P's that do not conduct to a QRS complex. And then the last part of this poem says, if P's and Q's don't agree, then you have a third degree. So basically, what that means is that you have P waves and QRS complex that do not agree. Sometimes you're going to have a P without a QRS. Sometimes you're going to have a QRS without a P. So it's a complete chaos between P's and QRS. That is a third degree heart block or a complete heart block. So this is very, very interesting to know when you are interpreting an EKG and you're dealing with heart blocks. I remember when I was in the emergency room, or I worked as a nurse in the emergency room, this came in handy. Understanding heart blocks was very important because we see it in the emergency department very often. Sometimes we're giving a medication. Let's say you're giving a beta blocker, and then you see a patient going into a first-degree heart block. Or you can see a patient basically with a history of a first-degree heart block. And it's important to understand these changes. So I wanted to talk very briefly about heart blocks. The other topic that I want to talk to you is identifying atrial fibrillation. You have to understand that atrial fibrillation is an irregular rhythm. You have a scenario where the EKG presents with multiple P waves. So in an atrial fibrillation, you're going to see multiple P waves. The rhythm is irregular. The heart rate can be normal, bradycardia, or tachycardia. And you're not going to be able to identify the PR interval. Why? Because there are multiple P waves. You're going to be unable to identify the PR interval. You have to understand that atrial fibrillation, there are some complications to this condition that we can see. So basically, due to the ineffective atrial contraction, the patient can develop decreased cardiac output, but also there could be the possibility of formation of thrombi, clots, that can go into the brain and cause a stroke, can go into the lungs and cause a pulmonary embolism. The causes for atrial fibrillation could be irritants such as alcohol, caffeine, also physiological conditions like electrolyte imbalances, but also psychosocial problems such as stress can cause atrial fibrillation. So it's very important to know the causes for the NCLEX. For the NCLEX, usually the questions, they're going to be relating to nursing interventions that are appropriate for a client, for a patient that have atrial fibrillation. And basically the treatment is going to be one of these three. One, control the rate, the ventricular rate. Two, to prevent clot formation, and also cardioversion. Basically, either we're going to do control the rate, prevent clot formation, or basically convert or revert the rhythm from atrial fibrillation to normal sinus rhythm. So what are the medications that we can give in patients that have atrial fibrillation? To control the ventricular rate, we can give medications such as calcium channel blockers, also beta blockers, or digoxin. To prevent clot formation, anticoagulants. And to revert the rhythm from atrial fibrillation to sinus rhythm, we have to give medications like amiodarone or procainamide. Also, cardioversion is an intervention that can also be performed to help a patient with atrial fibrillation. Another condition that you can see on the NCLEX that it is similar is, instead of being atrial fibrillation, is atrial flutter. Atrial flutter, when you look at the EKG strip, you're going to see that instead of having multiple P waves that are chaotic, you're going to see multiple P waves, but they have a different pattern. They have a regular sawtooth or shaped flutter waves or pattern. The reason why it looks more organized is because the extra electrical impulse is generating from only one single cardiac cell that is ectopic, not multiple ectopic cardiac cells, such as in atrial fibrillation. So the pattern is going to look a little bit more organized. It can still be regular or irregular, but it looks more organized. The heart rate, normal, bradycardic or tachycardic, but also you're not going to be able to measure here the PR interval. The causes can be similar, but also you can have conditions such as rheumatic fever, ischemic heart disease, heart failure, atrioventricular valve disease, septal defect, pulmonary embolism, thyrotoxicosis, and alcoholism. I see here, see somebody here, Professor, I passed the NCLEX with your videos. Thank you very much. And I see Vicky here also saying hi. Finally, I'm able to watch your live from the bottom of my heart. Thank you so much for sharing your knowledge and time to us. I appreciate it. Thank you, Vicky, and welcome. Welcome to NCLEX Crusade International. Okay, I got EKG questions here on my test, Professor. Thank you. Okay, very good. Okay, so these are different conditions that can cause atrial flutter. So it is important to know, because you could see a selector that apply on the NCLEX that say, well, what are the causes for atrial fibrillation, atrial flutter, and you have to understand what they are. Nursing assessment is important. How to assess for atrial flutter. Basically, we can see that the patient describes palpitation, weakness, fatigue, shortness of breath, decreased cardiac output, anxiety, syncopal episodes, angina, heart failure, shock. These are all conditions or symptoms that we can see in patients with atrial flutter. But of course, remember also, as in atrial fibrillation, remember to look for those complications of a pulmonary embolism or stroke that are high risk in patients that have AFib or A-flutter. The treatment, pretty similar. Basically, reduce the ventricular rate, also to prevent clots with anticoagulant, or treat the ventricular response with calcium channel blockers or beta blockers. Cardioversion is also an intervention, and one that is more frequently used for flutter is a radiofrequency catheter ablation. Radiofrequency catheter ablation, it is used because with this procedure, they can go through the cath lab and destroy the tissue that is causing the arrhythmia, and they can terminate the arrhythmia this way. So it is very important to know this, because atrial fibrillation and atrial flutter are conditions that you can see on the NCLEX. Okay, for our next slide, I want to talk about premature ventricular contraction, ventricular tachycardia, and ventricular fibrillation. So for the next slide, we're going to be talking about those topics. I'm going to bring some questions, also bring some images so you can see about PVCs, ventricular fibrillation, and ventricular tachycardia, because they are conditions that appear on the NCLEX more frequently. They are conditions that the patient can deteriorate very rapidly, such as, of course, ventricular tachycardia and ventricular fibrillation. But I wanted to pass by today and talk to you a little bit about heart blocks, atrial fibrillation, and atrial flutter. I'll see you on the next slide. Thank you for joining NCLEX Crusade International. God bless you all. I hope the videos in this channel are helping you tremendously. Bye-bye. Have a good day.